my name is Dr. Galyna and I have a mission today. And my mission is to explain you what is cellulite and what to do with cellulite. I'm gonna keep it simple. Embrace your cellulite. It is normal. It is a condition that affects 99.9% of women at a particular stage in their life or at any stage in their life. It can be there whether you're fit, whether you're healthy, whether you're skinny, whether you're curvy. Cellulite is there majority of your time. I embrace my cellulite. It's my best friend. Hope you can embrace it. But if you can't, let's talk what we can do. What exactly is cellulite? I'm gonna draw. They did kick me out of art school for a reason. And what I have done is I've represented you your skin. That is your skin. That is a collection or a layer of subcutaneous fat cells. And of course, we have the muscles and whatever sits underneath. We're not interested in that. We are interested in one particular enemy. It's a fibroid band. Sometimes it's called septi, sometimes it's called fibroid connection tissue, and they run all the way from the surface of your skin through the fat layer all the way to the muscle. So those are fibroid bands. The pool of the fibroid band predicts the dimpling in the skin. It is an absolutely normal condition, doesn't cause any discomfort or any pain, and it only causes aesthetic discomfort, let's call it this way. Cottage cheese, orange peel, dimples, whatever I've heard, that is just common names for cellulite. Different medical gradation of cellulite, but I like the most simplest one. Stage 1, no visible dimpling. Number 2, visible dimpling when you're standing up, but they disappear when you lie down. Don't we all love our bodies when we lie down and then you stand up, boom, you can see the cellulite. If you are stage 2 or stage 3, that is probably when you're gonna start seeking treatment. But in order to understand what treatments to look for or what treatments you might need, we need to understand what causes cellulite or what causes the dimpling. So first of all, of course, if you are gonna put on weight and your existing fat cells are gonna expand, they don't multiply. It's not that you're gonna have more fat cells. This is a fat cell, you eat more, exercise less, boom, it grows, it gets bigger. So of course your compartments will get bigger, they get chunkier. So your subcutaneous layer of the fat will increase, and that will put more strain on the fibroid band. So they will become tight and they will increase the pool on the skin, and that will go into a dimple. So the outer layer of your skin, the dimpling is where the fibroid band is attached and pulls in. Weight gain, one of the causes of cellulite. When you never had cellulite before and then you put on, a few pounds, boom, you start noticing a little bit of cellulite. Actually, it does not necessarily have to be weight gain. It can also be retained water. If you're a man, most probably you've never heard of cellulite because you don't have it. Okay, you've heard about it because your other half would have told you, oh my God, look at my cellulite. Girls never do that. The fibroid bands in women go horizontal. Is it horizontal? Vertical. Vertical. And they're parallel. In a man, they are crisscross. So this band is actually crisscross. That's why even if there is a pool, it doesn't create dimpling. But we're the lucky ones. Retain fluid at least once a month, and you know what I'm talking about? You will feel sluggish. You will feel as if you are completely puffy, consist of water, swollen up. Your lymphatic drainage is reduced, and in between all those beautiful fat cells lies excess water. This is terrible, but it's very represented. So your fat cells are not enlarged, but in between fat cells, water, water, water. And of course, still, this expands the compartment, puts pressure on the fibroid band. It pulls in, creating another dimpling. That is your dimpling at cellulite, just the pressure of the fibroid band. Another cause of cellulite, and this is probably not the young girls, that is probably after 30, 35, 40, 45, after 50, we start losing elasticity. Our skin becomes lax, saggy, whatever word you're going to use. But basically, the resistance of the skin to the pull of the fibroid band is broken. So it's vulnerable. So even without a strong pull, you can still see dimpling because skin is not strong enough to resist the the pool of the fibroid band. Basically, there is a lot of reason for you to have cellulite, starting from anatomy to physiology to lifestyle to the time of the month. Everything contributes towards cellulite. The question is, what do we do? How do we fight this monster? I suggest not to fight and embrace it. I'm going to repeat it again and again and again. I know a lot of my patients and a lot of my friends, and actually probably every single woman would rather she doesn't have cellulite. Because there are multiple reasons for cellulite to exist, we have to attack multiple reasons to make it better. No matter what you do, no matter how much money or how many treatments you go into use, cellulite treatments are not permanent. Most of them will have to be repeated. Keep that in mind. Of course, we need to make sure that the number and the size of fat cells is at constant, so you don't fluctuate in your weight. First of all, we want to look after the pool of the fibroid band. And this is where acoustic therapy or shock wave or something like Unison or Z-wave will be beneficial. But even lymphatic massage, manual lymphatic massage, will break down the acute pool of the fibroid band. You have to address lymphatic drainage and make sure you are not retained, you are not water retained. So make sure you drink plenty of water, you dry brush, but also you do physical exercise, because that will boost your lymphatic. You want to look after the skin and the quality of the skin. And if there is a bit of laxity, you want to address and maybe boost the collagen fibers in the skin to make sure that your skin is tight and resistant. So as you can see, it is a multiple, there are many factors. You have the skin, you have the fibroid band, you have the water, you have the fat cells. There is a lot. There is a lot to consider. The treatment is the best that addresses your need best. Make sure that you look for the treatment that in the same time addresses all these multiple platforms: the skin, the retained water, lymphatic drainage, fibroid pool, and of course the size of the fat cells. Everything. It has to address everything I've talked about. You can always DM me, and after we have a consultation and I take into consideration your lifestyle and everything you've done so far, only then I will be able to tell you what would be the ideal treatment for you. Hopefully this helps. Thank you.